studying the economics of investing in prevention. His work focuses on strengthening economic evaluations of behavioral health prevention programs and evaluating the utility of performance-based public-private partnerships to access new resources for improving health. This includes utilizing decision science tools, advanced analytic designs, and technological solutions to optimize prevention strategies. Dr. Crowley chairs the Society for Prevention Research's Task Force on Economic Analysis of Prevention, sits on the National Academy of Sciences Committee on the Use of Economic Evidence for Investing in Children, and operates an NIH-supported research network on the economics of prevention. Mouthful.
So, shall we switch?
Do you want to switch?
Yeah, I think so. I think we'll place the musical chairs. So, thank you very much, Denny. And again, I want to say thank you again to Neil for all of his work with logistics and making today possible. It's great to see such a diverse group of people here from a lot of different areas coming to think about and hear about the economics of prevention. When Denny and Neil and myself first started talking about the vision, what this would look like, it was coming out of multiple briefings that have been done where there was a lot of traction, a lot of discussion coming out of those briefings about the economics of prevention. So we thought it was time to focus, especially in light of some of the opportunities and some of the legislation and other initiatives around Pay for Success that are starting to be or being considered. So we're very excited about the opportunity to discuss these new developments in the science and practice of investing in prevention. So today what I'm going to share is going to include some examples of, and what the other groups in this first panel are going to share are some examples of the successes in economic evidence being used to inform policy, discussion of a growing system for helping states build cost-effective prevention portfolios, as well as efforts to support and facilitate this rapidly growing area of Pay for Success, which I know many of you are here to think about and see about different perspectives. But first, we wanted to provide a brief overview of the scientific progress around understanding the economics of prevention and share some of the key, and what I want to do is share some of the key lessons that we've learned from research over what's really been the last 5 decades of this growing area of prevention science. And Denny was saying that we're one of the most rigorous areas of science, but we often don't do the best job of marketing ourselves, and it's now in the context of the current budgetary climate that we've really had the opportunity to kind of step into the light. So this growing area of scientific inquiry has highlighted opportunities to reduce burden on the criminal justice, healthcare, education, and social service systems, as well as increase productivity in the workforce. And so we've seen this in a variety of domains, a variety of areas, and so we want to think about it from that interdisciplinary area, that multiple domain type thinking. So evidence produced by these studies has included increasingly useful information about maximizing the impact and return on investment of prevention strategies across the board. So to explore this, I'm going to share and discuss the economic evidence of a couple preventative interventions that allow communities to invest particularly in families and their children. So a few of these are examples of evidence-based prevention programs, in particular for children. Those include well-known home visiting programs, as well as such as the Nurse Family Partnership Program, Healthy Families America, as well as others such as parent-child interaction therapy, which can be sometimes conceptualized as a treatment, but when we think about intervening in early life, we can consider it as a type of domain of prevention as well. I also am briefly going to touch on some more adolescent type prevention, in particular functional family therapy. But first, what I'd like to do is consider some of these early childhood strategies. So many of you are probably familiar with the Nurse Family Partnership Program, but briefly, Nurse Family Partnerships is a maternal and early childhood program that provides first-time parents with the support from nurses beginning during pregnancy and following children after birth. And this generally includes home visits, around 60 home visits, at a cost of about $10,000 per family served. So this investment, what it leads to is approximately, and we've already kind of heard allusion to this, it leads to about $27,000 in benefits from things like reduced preterm births and health problems, as well as greater maternal employment in particular. And so these benefits and costs are based on a broad meta-analysis conducted by the Washington State Institute for Public Policy. You might hear a little bit more about that, I'm expecting in this panel. And, but in this context, what we can see from these numbers is that delivering NFP to one family on average, so this on average, leads to savings of around $17,000. And this can be interpreted as for every $1, if you will, invested in NFP, there's this downstream savings of $2.77. So this is the conversation, this is some of the discussion that when we think about prevention, we think about the economics of prevention, we start to hear these types of numbers. We talk about the cost, the benefits, the savings, as well as this kind of benefit cost or cost-benefit ratio, and the opportunities that present. And so what we can do is we can then start to consider, for instance, a different, also effective home visiting program. So Healthy Families America, and so this program is effective, as well as the Nurse Family Partnerships program. But when we start to consider the economics using known, peer-reviewed, published evidence, what we see is that while the program has a cost that's under $5,000, it also leads to monetizable benefits of around $2,300. These benefits, again, are largely from maternal employment and reduced child abuse and neglect. But in the case of this program, based on what we know now, based on the science, when we consider whether this program actually saves society, so from a societal perspective, whether it saves money, we see that the program in this case is not in fact cost effective. So this highlights a really important issue around evidence-based policy solutions for intervening with youth or intervening at any point during the lifespan on any area. Yeah, and that's while the program may be effective, it may work, it may not do so as efficiently as another program, right? And so by spending limited resources on, for instance, the less efficient program, which Healthy Families America arguably may or may not be, we can go to the science to make that decision. But when we do spend it on something where we might have a more efficient option, we end up having a smaller net impact, not only from an economic standpoint, but of course from a human impact standpoint. And so what we want to do is, of course, have the greatest impact and help the most people, and that's what we're all about in prevention. So a third program to consider, for instance, is parent-child interaction therapy. So in parent-child interaction therapy, what is actually going on is a therapist directly observes a parent and a child through a one-way mirror. And they actually provide direct coaching to the parent through a radio earphone, so through a mic, right? But the idea, the focus of this program is to build parents' skills to interact and manage their children's behavior in a positive manner. So here we see a particularly favorable impact for this program, PCIP as it's often called, when the program is implemented with families, particularly in a child welfare context. So in a context where we know that not only are the costs quite high to the state, but the costs are quite high to the children and families who are involved. So what we see is delivering this program, on average, again, it can provide about around a $15,000 benefit. But what's important and what we wanted to share in this overview is that we always want to dig deeper into these numbers, right? And think about and look at what program effects are actually driving these benefits. So when we're having that policy conversation, we can have it in a more nuanced and deeper level that allows us to craft high quality policies for intervening and helping. So so what we can see is, so we can dig into what that number is. So for parent-child interaction in therapy, what we can see is that a majority of the savings here is from preventing, as you would expect, abuse and neglect, particularly when we're considering this in a child welfare context. But it's also from increased earnings. The families actually having increased earnings from being able to achieve greater levels of employment. So decreased child abuse and neglect, it saves both the family money from the consequences that we know that are of child maltreatment and the many both human costs and economic costs surrounding that, but it also saves taxpayer resources from reduced burden on the social service system. Further, this increased employment, of course, it leads to greater earnings by the families, but again, also a greater government tax revenue. So we see not only are we engaging in cost aversion here, but we're actually increasing the productivity of our workforce. So while most of the monetary and non-monetary value of this program in particular is to the families and the children, which is where we want to see that value going, but we also see that at the number at the bottom that you might not be able to read, is that taxpayers receive over $4,000 in benefits. So these are public to the government benefits for each family who receives this program. So this government savings alone more than pays for the cost of the parent-child interaction therapy. So when we're talking about things like performance-based financing or pay for success, or many of the other types of financing models that are particularly relevant to the discussion that we're having more and more often, this number is very valuable. What's that fiscal argument? What's that impact to the state or to government and taxpayers? And so in this case, we would say that when we take that perspective, this program represents a good investment in preventing, in this case, in particular, violence against children. But as we can see, it has impacts across domains. And so we don't want to limit ourselves to just thinking about those most immediate benefits. So now I want to briefly consider two other programs for youth that, and this is for adolescents, many times who might already be exhibiting some sort of negative behavior, some sort of maybe delinquent behavior. Again, particularly relevant in the context of pay for success and juvenile justice and the opportunities that we have for changing youth trajectories, keeping them out of prison, and or trying to intervene and stop that pipeline that was alluded to earlier. In particular, one program is functional family therapy, sometimes referred to as FFT. So functional family therapy, just to give you a little taste, a little background on what do these programs actually look like on the ground? What are we actually doing in terms of intervening? This is a 12-session, 3 to 4 month therapeutic process that focuses on the relationships with the family versus just on the individual. So once again, the kind of taste we want to give this overview is opportunities to be not just with an individual, but in the systems that surround that person, in particular the family, and value that helping families overcome problems play in many of the prevention programs that we think about. So what functional family therapy does is it aims to enhance family strengths through individualized treatment and incorporates the uniqueness of each family's cultural and structural variation. And the program is guided by this belief that, for instance, violent behavior in particular in youth is linked to unhealthy family processes that make them susceptible to deviant peer influences. So we're thinking about the interface here of psychology, of behavioral intervention, and the economics. So functional family therapy has been found to significantly reduce violence, drug use, and crime. But something that's particularly important, and we'll talk about in a second, is that the therapist must adhere closely to the program's protocols, and they must have the resources to do so in order to achieve maximum effectiveness. So we can look at, once again, the costs and the benefits, as well as the savings and that benefit-cost ratio, again, of a program like functional family therapy. And what we see is, is there is a meaningful cost per family, but the benefits greatly outweigh those costs. This can be contrasted with a still commonly used but highly ineffective juvenile crime program that many of you probably have heard about, and what it's often called, although it has been repackaged as other things, is scared straight. And so this program, as many of you are probably aware, seeks to intimidate youth into avoiding prison, yet it's been found on numerous occasions in different evaluations to actually raise criminality in youth. The program costs about $66, and this low cost being part of its appeal, right? Because when we compare it to something like functional family therapy, it seems like it's a lot more low cost option. But this is a get what you pay for kind of situation. But the program leads to an average societal cost, not a benefit, but an increased cost of over $13,000 from that increased criminality per child who receives the program. Over $3,000 of which is to taxpayers. So thinking back to that number that I was pointing out with parent-child interaction therapy, where the taxpayer benefit actually offset that cost, in this case, we see that we see $3,000 in increased cost per child who ends up, on average, per child who ends up going through a program like Scared Straight. So perversely then, for every dollar spent on Scared Straight, the program not only increases delinquent behavior, but what we actually see is nearly a $200 increase in societal costs. So programs such as Scared Straight make what I think many of us would argue is a strong case for relying on evidence-based programming. So we really want to put that out there. It's not just about any prevention. It's not just about being well-intentioned when we engage in prevention. It's about using the data, relying on the science to make strategic decisions, strategic investments in prevention whenever we engage. And that's not only to protect children or protect whatever vulnerable population we may be intervening in, or the general population, of course, but also making sure taxpayer money is being used as effectively and efficiently as possible. So in this context, the economic evidence that these programs provides, that I shared today, these programs really provide only a sampling of the growing body of literature in the space. And so we're going to hear about some other programs and some other opportunities that are out there. But these and other economic evaluations have allowed us to facilitate strategic investments in prevention efforts and help us improve health and well-being and save public resources. But in particular, researchers and practitioners, what we've found, we've actually identified key opportunities to ensure that successful prevention efforts occur, so that we can use to actually increase the likelihood that prevention effort is going to be successful and it's going to have a positive return on investment. And so briefly, I'm going to share some of these, and of course we'd be happy to talk about them in greater detail later and the nuances of them, but broadly, with broad strokes, these include the need to invest in the infrastructure to support these programs, the importance of assessing the fiscal impact of prevention across traditional government silos, so again, thinking about that multi-domain, interdisciplinary focus. We're not focused on one single area, we're looking across health, across criminal justice system, across education. And also the importance of evaluating the fiscal impact of programs on an ongoing basis, right? So we'll talk about that a little bit more. But first, the idea of investing in prevention infrastructure is essential. We found it to be essential to ensuring programs are delivered as they are designed. So thinking about back to functional family therapy or PCIT, the importance of the facilitator, the person actually engaging and providing that direct service engagement, of them actually delivering the program as it was designed is essential. But to do so requires infrastructure and resources be in place, and we know that on-site and local service context that there's tremendous variability in the capacity that's there. But we also know that through strategic deployment of resources, we actually can build that capacity and create a context where the prevention effort can be successful. We can see these types of return on investment. So similar to when we think about issues in medicine, when a medical treatment is used incorrectly, its effectiveness declines. And so we would expect the same from many of the preventative interventions that we seek to employ and support. In particular, because local infrastructure varies in much more degree than you would find in hospital settings, where much of the training and protocols are standardized, we know that doesn't happen in many of the service contexts where we find prevention. So when local capacity is insufficient to implement certain types of prevention programs, what we often find and we found based on our research is that we must first build that local capacity before the prevention program can be successfully deployed. And that's key. And the failure to do so before implementing or even expanding prevention programs can doom the effort even before it begins. And we really, I think that there's just a tremendous amount of evidence speaking to that. And in doing so, when we don't have that local capacity, we end up jeopardizing we jeopardize the initiative's cost effectiveness. But one thing to point out is that the process of building that capacity, many might say, well, investing in infrastructure, that could be a huge cost, right? But what we're finding is many of these programs, particularly those that have this high return on investment, we can make those investments in infrastructure, in capacity, without jeopardizing the cost effectiveness of the effort. I think that's something some people sometimes get caught up on. So a second lesson when making investments in prevention is to consider intervention impact across these multiple domains. So for instance, a program that's designed to improve the health of infants, the health of babies, and help families reduce the number of emergency department visits that they go to, particularly if those families might not carry their own insurance, they might rely on state or public insurance programs. We can think about opportunities that there are a variety of different prevention programs that have that goal, right? But what we see is that some of these programs actually have these downstream benefits, for instance, from reduced special education or reduction in behavioral problems that lead to later on in life to engagement in the juvenile justice system. So by taking a broader perspective, stepping outside of our immediate focus, what we see is that these multi-domain benefits, they highlight prevention, the economics of prevention's impacts of intervening early across the board. Further, when we're developing policy and budgets that consider such benefits, it allows us to make more accurate projections about the spending and cost aversion that we're going to see from these programs. This in turn can lead to greater efficiencies in the public services we offer, but also allows to avoid having redundant programs. And they really ensure that we have the resources to provide adequate coverage of other essential services. So again, that we can find efficiency by taking this broader perspective. So the third opportunity before I end that we wanted to point out was that there's an opportunity now to integrate ongoing evaluation of the impact, in particular the fiscal impact of many of the prevention-based policies that we have into kind of the standard practice, right? And so this can include ongoing evaluation of whether the programs are working as they are supposed to and whether they're achieving, for instance, a projected budgetary impact, right? And this provides an opportunity to ensure that the limited resources that we have are providing the greatest benefits. So going back to that idea of that we have limited resources, we want to invest in not only what's effective, but also what's going to be the most effective, what's going to have the greatest impact, where there are efficiencies to be had. And so we want to do so, especially when we're thinking about investing in public health and welfare. And also, by having ongoing evaluation, this increases our capacity for accountability in how we make public spending decisions. But while the cost of high quality evaluations, so we often talk about we want to evaluate more, and people are like, well, the cost of doing so is huge, right? But these evaluations of interventions do not always have to be these kind of Cadillac trials, right? We're not talking about running huge clinical trials here, where we have an opportunity now thinking about some of the high quality administrative data systems coming online to think about how we can use those to evaluate. And so not only running low cost RCTs, which is talked about a lot these days, but how do we run low cost economic evaluations, right? So how do we run low cost budgetary impact analyses of some of the programs that we're engaging in? And so we think that there's a lot of opportunities there, and particularly within the policy space, to consider how we can use federal and state data, how we can open up that data to help us optimize our benefits in public spending protection. So in kind of overall, so here's my contact information and just kind of the larger stepping back perspective overall is that, well, not only are we offering strategies for maximizing prevention impact and the return on investment, but we find that these represent opportunities that can be put into place now, wherever prevention is. So these lessons that we've learned, there are many others out there, and I'm sure that people in the audience have their own that they may take away from some of the work that they've done, their experiences with prevention. But what we know now is that if we want to put high-quality prevention initiatives and policies into place, that by thinking about infrastructure, by considering and looking across the multiple domains of impact, and also being really thoughtful about how we evaluate the impact of these programs on an ongoing basis whenever possible, we have a huge opportunity to achieve not only impactful prevention, but prevention as a positive return.